Hi there, I'm Jennifer James, one of the directors in care management. The care manager role that includes pre-service work and post-service work is essential. And this clinical role is really focused on clinical reviews that come from our members and our providers to determine if it meets the evidence-based criteria. We want to ensure that our members are receiving the appropriate and quality care that we want for our members.
Hi, I'm Catherine. I'm one of the directors here at Blue Cross Blue Shield in the Care Management Division, and I oversee our health coaches. Health coaches at Blue Cross Blue Shield help our members navigate the health system, improve their health, and help prevent any avoidable readmissions.
I work with patients who are trying to navigate the healthcare system while managing their health, and I'm able to provide them opportunities to find the healthcare team that they need, and I can listen to their challenges and what their barriers are. I'm able to use their support system and then celebrate their successes.
A typical phone call that I make and receive is we work in collaboration with our customer care advocates, which is customer service. So they may send a member over who has a new diagnosis of cancer and they're needing help being guided through this process. So we help find in-network providers, we help them schedule appointments, we go through the prior authorization process, we go through the medical policy. It's truly just a blessing to be able to help someone from the beginning to the end and continue on to make sure they're happy and healthy and enjoying their life.
Every member is different and every need is different. So they might suffer from maybe some of the same chronic illnesses, but they're all managed differently and they all need different help. So to be able to point them in the direction of provider help or helping to answer their questions, providing education, just being able to support them, providing community resources for them, whatever it might be, that's what makes this job so fun because you can help in so many ways that I didn't feel like I've been able to in other nursing roles.
We really ask for 3 years of clinical experience so that you understand that continuum of care. And then you have to balance that with learning the insurance industry, the benefits, the coding. How does insurance work?
One of the challenges that we have to work with in utilization management is working with the providers. Working with the providers is awesome, but it can be a challenge when they are requesting services that are not appropriate for the member, and we can negotiate with them as needed or come to some kind of conclusion for the member's best needs.
One of the biggest challenges for nurses that come to Blue Cross is they are sitting at a desk all day long and they talk to members over the phone and they're not able to see them face to face. So having that conversation with a member over the phone can be challenging at times.
The collaboration within my team is incredible, but we work really closely together and make sure that whenever we have questions or trying to learn how to best help a member, that we reach out and they are more than willing to help me.
I get to work from home most of the time and I telecommute in about twice a week for team meetings and meetings with the medical directors and the rest of my team. My work schedule is very flexible. I'm able to take breaks when needed for doctor's appointments or family events, which is really excellent that way.
One of the things that makes me successful here is my previous job experience as a nurse, my previous training in prior authorizations here at Blue Cross, and the training that I have received.
Training really helped me understand what it is like to work in corporate and other side of nursing, which is not bedside nursing.
I really enjoy thinking that I'm helping the member by my role in Blue Cross.
That you do not lose your nursing skills. Your nursing skills are actually sharpened.
One of the great things about Blue Cross is we really value our talent here at Blue Cross and we try to grow individuals into whatever role that might be best for them, whether it's a leadership role or other roles within the organization that might support our program.
I think as a nurse, a lot of times we think our only advancement is to become a manager. But here at Blue Cross, there are so many different areas. You can either do lateral moves and do different types of health coaching or utilization management and other roles that require nursing degrees. But then you can also move up, and it's not just in management. There's team leads and there's other areas of leadership.
I started out with a health coach. Oftentimes they're called case managers. Learned the ropes with the health coach, was able to master that, enjoyed my job. So I was one of the 4 regional health coaches that implemented the advocacy program, which is a specialized health coaching pilot. I became a health coach lead after spending about a year in the advocacy program. I applied for a clinical account management role, and that's what I'm currently doing now.
Hello, my name is Glenn Pomerantz. I'm the Chief Medical Officer, and I'm a Senior Vice President here at Blue Cross Blue Shield of Minnesota. Our vision for healthcare, we believe, is what we want as all Minnesotans, and that is that insurers and the great doctors, hospitals, and nurses, that we get together and work on behalf of our members for their best outcomes. That's what's important. And if you work here at Blue Cross, you will feel that you are aligned to that mission every day.